Hello guys, after completing the first part of amyloidosis, now let us move to the second part of the amyloidosis. In the first part of amyloidosis, we have discussed the property and the classification. Now we will be looking upon the diagnosis and the organ involvement. So let's get started. So for the diagnosis, we undergo the biopsy. The best used test for the biopsy, that is the abdominal fat biopsy. So this is the picture of the abdominal fat biopsy. The next used test, that is the rectal biopsy. And the third use test, that is the tongue biopsy. After doing the biopsy, then we have to stain the part or the specimen. So staining. For the staining, the best stain used are listed below. First, that is the H and E stain, which will give the pink color appearance. The second, that is the PAS stain, that will give, this has to be remember that will give the magenta color. The third one, that is the Congo red. Guys, this is the most important stain to be remembered for the amyloidosis. For the Congo red stain, it has under the light microscope, it will give the salmon pink appearance. And it will give the apple bifringes, apple green bifringes, birefringes. Now, the other stain which are less commonly used, that are fourth one, that is a methyl violet. It is also called the crystal violet stain. And so this one will give the metachromatic stain. The last one that is used, that is thioflavin. S and T. It will give immunofluorescence. The pictorial diagram of all these stain are seen here. So this is the stain for the HNA, which will give the pink color. Then this is for the magenta color, that is the stain for the PAS stain. This is PAS stain. The third one, that is the Congo red stain, which is under the light microscope, that will give the salmon pink appearance. Then the most important, so see, this is the renal biopsy done of the Congo red, which is giving the apple green bifringes under the polarized stain. Stain for amyloidosis. When we paint the cut surface of the particular organ, we paint it with the Lugos iodine. Lugose iodine will give the mahogany brown color. And when we add the H2SO4 sulfuric acid to this, it will give the blue color. So this is the confirmatory that the specific cut surface which you have taken from the particular organ, that is the amyloidosis. For the more specific to confirm the amyloidosis, actually it is the Congo red stain. Now let us come to the part that is the most important, that is the organ involvement, which is our fourth point. Organ involvement by amyloidosis. Organ involvement. The general points which must be remembered, that are: first, the most common organ affected. Most common organ affected, which is kidney. Second, most common death in primary amyloidosis. Most common death, that will be due to the heart disease, to the heart involvement. The third one, most common death in secondary amyloid. The upper one was actually the primary amyloid. It will be the renal disease. Now the gross appearance of amyloid. Gross appearance of amyloid. It will be this point must be remembered. First, it will be the waxy in nature. Then it is firm in consistency. Firm in consistency. And the third one, which is the organomegaly. First one, that is the kidney. The most common part involved is the mesenterium. Can also affect the walls of capillaries. Affect walls of capillaries and arterioles. The clinical manifestation which is to be remembered, clinical, that is the nephrotic syndrome. Please take a note that during the kidney involvement, the most common biopsy, that is the renal biopsy. Now the second organ involvement, that is the liver. In the liver, the most common part affected, that is the space of Dc. Space of Dc. What is the space of Dc? That is the space between the hepatocyte and the sinusoids in the liver. This will produce pressure atrophy of hepatocyte. Pressure atrophy of hepatocyte. The clinical manifestation, that is cirrhosis. The patient will come with the cirrhosis, or the patient is cirrhosis. the third organ involvement, that is the heart. The part of heart that is affected, that will be the subendocardium. And this is the most common affected part. The clinical representation, that will be the arrhythmia. Right bundle branch block. Right bundle block. And the restrictive cardiac myopathy. Restrictive cardiac myopathy. The fourth organ involved, that is the GIT, gastrointestinal tract. And the most common part here, that will be the macroglossia. That will be tongue. Macroglossia, clinical manifestation. The fifth part that is involved, fifth organ involved, that is the spleen. This need to be remembered. Actually, the spleen part, that is the two forms. Two forms. Two forms, that is the sago-spleen. Sago-spleen and the lardaceous spleen. Note, in the sago spleen, the follicles are affected. Follicles are affected. And in the lardaceous spleen, the affected part, that is the sinusoids, are affected. Sinusoids. The pictorial representation of this, that is here, the two parts, the sago spleen and the lardaceous spleen. Hence we have completed all our 4 points, that is the property, classification, diagnosis.